Correct. So Tuesday evening, we received an invitation for a meeting with the ADM and my president of my board and myself. And that's when we were informed that as of April 1st, 2026, financial subsidies will be ended and Transplant Quebec will cease to exist. After the initial shock from the ADM's announcement, we advised the board, and then I met with the employees. I have to say, it's beyond the shock. I have difficulty understanding the decision and having this bill come forth. Principally because we were in a parliamentary commission as of 2024, and Transplant Quebec was the organization that was favored as far as the one responsible to be in charge of the organ donation and transplantation for Quebec. The recommendations of that commission came out in October 2024 and were, essentially taking up everything or almost everything that we had mentioned in our memoir. Also, over the summer, I presented to Sonia Bélanger various elements that we thought would have to be present in a law. It was my understanding that the law for organ donation and transplant, because we're one of the only provinces that doesn't have one, was done, and they were going to be presenting this. So you can imagine my surprise when there was a complete turnover. Now, I understand Hema Quebec is saying that they will take up all of the resources. That is not the message I'm getting from the minister. The ADM. The message I'm getting is that Transplant Quebec will not transfer any of the resources. When I spoke to the president and CEO of Hema Quebec last night, she said we will welcome everybody in the organization. So then that brings forth an even bigger question for me. If the perspective from the Bill 7 is to save money, what kind of money will we be saving if all the resources are transferred to Hema Quebec? It doesn't make any sense to me. So the organ donation relies on rigorous coordination. The time frame is super short. The coordination is done between the hospitals, within surgeons, within families, databases, transportation, organizations with the various operating rooms of various hospitals throughout the province of Quebec, the waiting list, and medical priorities. It's an ecosystem that's super complex, for which around 30 to 35 coordinators, which are nurses that are highly specialized. They come from ICUs, they come from emergency departments, and once we've gathered them here, we train them for at least a year, because that training and the requirements that are needed to discuss everything with surgeon is high level, and so. To me, these activities are unique. They're specialized, they're niched, and they're surrounded in an ecosystem that's extremely difficult and extremely different, and at different abyss from blood donations. So I have a hard time saying why would we merge with an organization that's responsible for blood. So over the past 40 years in my career, I've lived through 6 health reforms, and every time I wouldn't call this a health reform, but it's similar. And so every time this happens, there is always a time frame where there is the merging of the organizations, where either the staff is super worried about what's going to happen to their jobs, how is this going to work, and to your point, yes, there's a kerfuffle that's created that perhaps can increase the risk. This is what we want to eliminate, and this is why we are asking the government to please remove that portion in the Bill 7 of amalgamating 2 organizations that have completely different values and different business models. If we had been inefficient, we had been in a deficit mode, we had not been performant, no performance whatsoever, perhaps I would understand. But that's not the case. We are not in a deficit. We are efficient. We are performing. We haven't performed this well since the history of Transplant Quebec. We're working in collegiality with all the health organizations. We have a super reputation. Why? And we're not going to save money. So to me, we talked about efficiency from the premier said in his speech, he had four big priorities. One of them was, let's make sure that we have the economy that we can have, and let's make sure that we are efficient. We score in both. So why should we transfer?